Welcome back, everyone, to the deep dive. We are diving into trauma-informed care today, or, TIPUSH, as it's often called,
Right.
and thinking about how to actually integrate it into healthcare,
Yeah.
education,
Mhm.
social services, really. I mean, all the places it's needed.
Oh, absolutely.
And you guys have sent over a really interesting mix of sources
Yeah.
this time around.
It is
We've got some
fascinating.
research,
Yeah.
some policy stuff, even a blog post with a very unique take on this.
Yeah.
So
It's a good mix.
I'm excited to jump in.
Yeah.
I think what's most striking to me right off the bat is just how widespread trauma is.
Yeah.
One of the studies we have here says almost 90% of U.S. adults have experienced some kind of traumatic event.
That's huge.
Yeah.
That's a lot.
Yeah, it really underscores why this can't be,
Right.
just a niche thing anymore. It has to be the standard.
Yeah.
It's interesting, though, because I think we all know trauma exists, but we don't often think about like the ripple effects of it.
Right.
It's not just the individual,
Yeah.
it's their relationships, their community.
Yeah.
The effectiveness of trauma-informed care implementation study talks about it as a trauma landscape,
Okay.
which I think is such a helpful visual.
So not just a flat map, but
Yeah.
we're talking peaks and valleys depending on, the person,
Exactly.
their support system, even like societal stuff piled on top.
Yeah, exactly.
Wow.
And this is where TIC starts to get really interesting because it's about
Yeah.
acknowledging this complex landscape and shifting our whole approach. So instead of asking, what's wrong with you?
Right.
It's, what happened to you?
Mm.
Simple change in language, but it changes everything.
Yeah, it's like instead of looking at the symptoms and judging, you're looking for the root cause with empathy.
Exactly.
Now, you mentioned SAMH-A. They have those 10 domains for implementing TIC, right? Right? That felt a little dense even for me.
It is a lot to take in.
Yeah.
I think for our purposes today.
Let's focus on the ones that really highlight, how we can do TIC,
Right.
not just talk about it. So one that really jumped out at me was engagement and involvement.
Okay.
And this is all about involving people with lived experience of trauma.
Okay.
Every step of the way.
Right.
Not just as patients or clients, but in designing the services themselves.
Oh, wow.
The study actually gives a great example of this. They talked about how in pediatric intensive care, involving families in the care decisions, actually led to better outcomes for the kids. And the staff felt more invested in the approach.
That makes so much sense if the system is built
Yeah.
with the input of those who've been through it.
Yeah.
It's more likely to actually be helpful.
Absolutely.
And like on a human level, it makes people feel heard,
Right.
which can be so healing.
Yeah, absolutely.
Another one that stood out to me was training and workforce development.
Yes.
And, not just one-off workshops, but ongoing training that's tailored to specific roles. So like imagine a hospital where everyone from the receptionist to the surgeon understands trauma basics and how to, minimize re-traumatization.
That's the dream.
Okay, I'm picturing this. I'm going in for a checkup, feeling anxious because of, past medical stuff.
Yeah.
But even the person scheduling my appointment gets it.
Right.
The waiting room is calming. The doctor explains things clearly. It's like this whole environment is on my side.
That's the ideal. Yeah. And it's achievable if we prioritize training.
Yeah.
The study even mentions how the trainer model was super cost effective.
Okay, so there's a practical argument there too.
Right.
Cross-sector collaboration is another big one.
Oh, yeah. This one is exciting.
Yeah, this is where it gets interesting because it breaks down the silos, right?
Totally.
The quality implementation of trauma-informed care brief had this amazing example
Oh, yeah.
of a program in Charlotte, North Carolina, where they train police officers in child development and trauma
That's so cool.
so they can better interact with kids and families. Wow.
It's incredible.
So it's not just each field doing its own thing,
Right.
but recognizing that a person interacts with multiple systems.
Exactly.
That's huge.
Especially for folks who are navigating like healthcare and the legal system at the same time.
Right.
That collaboration can make or break their experience.
There's also screening assessment and treatment services, but I think maybe we can unpack that one
Yeah.
a little more when we talk about the challenges.
Yeah, because I have a feeling.
Right, because I have a feeling those are coming up next.
They are.
All right, listeners, buckle up.
It's about to get real.
Yeah.
Yeah. So, yeah, I think one of the biggest hurdles is pushback. You're trying to bring people on board, and it's not always outright resistance, but it's more like...
Okay, but give me the real talk. Like, what are you hearing when you're out in the field? What are
Yeah.
people saying?
It's that this is just one more thing on my plate feeling.
Yeah. Right.
Staff are already stretched, thin budgets are tight.
Yeah.
And TIC can seem like this big abstract ideal. So not malicious, but just kind of overwhelmed.
Right.
And maybe not seeing that immediate payoff.
Exactly. And that's where leadership is crucial.
Right.
Because if those at the top aren't truly on board, if they're not modeling it, forget it.
It's not just lip service. It's about actually putting your money where your mouth is.
100%.
Yeah.
Resources are the other biggie.
Okay.
Because, good tech training, adapting spaces to be more welcoming and safe, all of that costs money.
Right.
And when organizations are struggling just to keep the lights on,
it's hard to prioritize something that maybe feels touchy-feely when you're worried about basic necessities.
Yeah, but here's the thing. Not investing in TIC has its own costs.
Okay.
So think about a school with high suspension rates.
Mm-hmm.
On the surface, it's a discipline issue.
Right.
But what if those behaviors are actually trauma responses?
Mm-hmm.
If we don't address the root cause, those kids are set up for failure.
Wow.
And that has ripple effects on the whole community. So it's not just about being nice.
Yeah.
It's about preventing much bigger problems down the line.
Right.
It's like preventative care for the soul, almost.
I love that.
And then on a very practical level, think about staff burnout.
Oh, yeah.
If people are constantly dealing with challenging behaviors and they don't understand the why, they're going to burn out so much faster.
Exactly.
So you invest in TIC, and maybe you actually save money on turnover and training in the long run.
Absolutely.
Okay, now that's an argument for the bean counters.
There you go.
You also mentioned that measuring the impact of TIC is tricky.
Yeah.
It's not as straightforward as tracking, how many people got vaccinated.
Right. It's not a one-to-one thing. You can't just give someone a trauma-informed pill and call it a day.
Right.
The changes are often subtle. They happen over time.
So how do we know if it's working?
Well, it's about looking at a bunch of different things.
Okay.
Yes, you can track things like decreases in restraint use or client complaints, but you also need the qualitative stuff.
Mm-hmm.
Are staff feeling more equipped to handle tough situations?
Yeah.
Are people receiving services describing a greater sense of safety and being heard?
So the numbers tell part of the story, but it's really about the shift in the overall feel of the place.
Exactly.
And this kind of ties into that final challenge, which is making TIC stick.
Yes.
It's easy to get excited about a new initiative, do a training, and then poof, it fades away.
It's like that New Year's resolution to go to the gym every day that lasts, a week?
Exactly. A week, maybe 2 if you're lucky.
Yeah.
So how do we prevent that?
Well, this is where those clear policies, ongoing training feedback loops, all those seemingly boring things become absolutely essential.
Okay.
Because they provide the structure to support TICUS even when enthusiasm wanes or leadership changes.
So it's about building those habits into the system. So you're not just relying on willpower.
Right.
But I'm guessing that TIO blog post you mentioned has some thoughts on this too.
They go even deeper.
Okay.
They talk about cultivating a TIC's mindset.
All right, spill the tea. What does that even mean?
So it's about that constant questioning, how might trauma be showing up here?
Right.
What happened? Not what's wrong.
Right.
It's being willing to step outside your usual way of seeing things and really consider the impact of trauma on everyone involved.
So it's not just ticking boxes. It's a fundamental shift in how we approach the world.
Exactly. And that, my friend, is where the real magic happens.
Okay. So we've got the challenges laid out.
Yeah.
But our listeners are probably wondering, what now? How do we actually tackle these roadblocks?
Well, first, let's be realistic. Change takes time.
Mm-hmm.
It's messy. There's no one-size-fits-all solution.
Right.
But there are definitely things you can do, starting with education, obviously.
Right, because if people don't understand why TK matters, they're not going to be invested.
Right.
But how do you get buy-in from folks who are already feeling overwhelmed?
You involve them in the process from the get-go.
Okay.
Don't just dictate changes from on high. Create space for people to voice their concerns, ask questions, and even help shape how TIC is implemented in their specific context.
So if you feel ownership over something, you're more likely to make it work.
Exactly.
Okay.
And don't underestimate the power of celebrating small wins.
Oh, that's good.
Recognize and appreciate the efforts of staff who are embracing TIC principles.
So instead of focusing on what's not working, you're highlighting the positive. And that can be contagious.
Absolutely.
Now, when it comes to resources, sometimes you have to get creative.
Yeah.
Look for partnerships. Maybe a local mental health agency can provide training, or you team up with a university to do research and data collection.
Mm-hmm.
So it's about leveraging those community connections,
Yeah.
thinking outside the box.
Exactly.
And for measuring impact, sometimes the most powerful data comes from stories.
Oh, yeah.
You ask staff and clients what's changed, how they feel differently.
Absolutely.
The numbers might show a decrease in incidents, but the real story is in how people describe feeling safer, more respected, more hopeful.
Those narratives are gold.
Yeah.
They remind us why we're doing this work.
Okay, I'm feeling fired up. We've covered a lot of ground, but before we dive into that TIO blog framework, let's take a step back.
Okay.
Why does building a trauma-informed world matter? What's at stake here? Okay, so we're back and ready to tackle that TIO blog framework.
Yes.
You mentioned they really emphasize this idea of a TI mindset. And I'm still wrapping my head around it. Like, what does that mean beyond just, knowing about trauma?
Yeah, it is subtle, but it's really powerful.
Okay.
It's like you're constantly asking yourself, how might trauma be playing a role here, even in situations that don't seem obviously related at first?
So instead of jumping to conclusions about someone's behavior,
right,
like a student acting out or a patient missing appointments, you pause and consider what might be going on beneath the surface.
Exactly. It's that shift from what's wrong with you to what happened to you.
Right.
And it applies not just to individuals, but to systems too. Like, why are certain policies in place? Who are they serving and who are they maybe failing?
So always having that trauma-informed lens on, even when you're looking at the bigger picture.
Exactly.
Okay.
And it's not about having all the answers.
Right.
It's about being curious, being open to new perspectives, because trauma can manifest in so many ways.
Yeah. And sometimes it's not even obvious.
Right. Exactly.
That makes me think about screening, assessment, and treatment services. Like, how do we even know if someone's been affected by trauma if they're not outwardly, saying?
Well, that's where training comes in again.
Okay.
Healthcare providers, educators, social workers.
Yeah.
They need to know the signs, the subtle cues that someone might be struggling.
Right.
And it's not about interrogating people. It's
Right.
about creating a space where they feel safe enough to share.
Which brings us back to trust.
Yes.
You can't force someone to open up back. They have to feel like they're not going to be judged
Absolutely.
or dismissed.
And that trust isn't built overnight. It takes consistency. It takes demonstrating through your actions
Right.
that you really care.
So it's not just about having a trauma-informed policy manual.
Right.
It's about how you interact with people every single day.
Exactly. And that's where that TIO blog framework gets really interesting.
Okay.
They break it down into these 4 elements: education and training, which we've talked about a lot,
Yeah.
feedback processes, policy and procedure review, and finally, climate and culture.
Okay, so those last 3 feel a little less about individual skills and more about how the whole organization runs.
Right.
Let's take them one by one.
Okay.
What's the gist of feedback processes?
It's really simple, but so crucial.
Okay.
You have to create systems where people feel comfortable giving feedback.
Right.
And this is the important part. You actually use that feedback to make changes.
You actually listen.
Yes, and not just staff the people receiving services too.
Oh, okay. So think like suggestion boxes, surveys, maybe even focus groups, where clients can share what's working, what's not.
All of that. And it has to be ongoing.
Right. Not just a one-time thing.
Because the needs of your population might change. Your staff might have new ideas. It's dynamic.
Okay, and then policy and procedure review?
Yeah.
That sounds a little bureaucratic.
It does.
But I'm guessing it's more than just updating the employee handbook?
It is. It's about looking at every single policy through that trauma-informed lens.
Right.
And asking, does this create barriers for people? Could this be re-traumatizing?
Yeah.
Who does it benefit? Who does it leave out?
So even something like a school's attendance policy
Right.
could be unintentionally harming students who've experienced trauma.
Absolutely. Maybe a kid is missing school because their home environment isn't safe.
Right.
And getting punished for truancy just makes things worse.
Wow.
Or a hospital's discharge policy that sends someone back to an abusive situation without adequate support.
I hadn't thought about it like that, but yeah, the sister itself can be a source of trauma.
Exactly. And that's why this regular review process is so important.
Okay.
You're constantly checking to make sure your policies are aligned with your values and actually helping people.
So training, feedback, policy review that leaves climate and culture,
Yes.
which feels like the trickiest one to pin down.
It is, but also the most important.
Okay.
Because it sets the tone for everything else.
Mm-hmm.
It's about creating an environment where everyone feels safe, respected, and empowered.
So not just what people say, but how they act.
Exactly.
Like if a school claims to be trauma-informed, but the hallways are chaotic and punishments are harsh, That sends a very mixed message.
Totally. Think about the physical space.
Okay.
Is it welcoming? Are there quiet areas for people to de-escalate? But it goes deeper than that. How do people communicate?
Right.
Is there a culture of blame or a culture of support?
So walking the walk, not just talking the talk.
Exactly.
Embodying those Tucky values in every interaction.
And it's not something you can just implement. It takes ongoing effort, reflection, being willing to mess up and course correct.
It sounds like building a trauma-informed culture is almost like a form of healing in itself.
That's a beautiful way to put it, because when you create an environment where everyone feels seen and heard, it creates ripples of healing that extend far beyond the individual.
Wow, we've covered so much ground today.
Yeah.
I feel like I have a whole new understanding of what it means to be trauma-informed.
It's been a pleasure exploring this with you.
And listeners, I hope this deep dive has given you some food for thought and some concrete tools to start making a difference in your own corner of the world. Remember, every step towards creating a more trauma-informed society, no matter how small, is a step worth taking. Until next time, keep learning, keep questioning, and keep diving deep.